It starts with a simple cough and a fever, looking just like a common cold. But within days, it transforms into one of the most contagious diseases known to mankind. The virus can hang in the air for up to 2 hours after an infected person has left the room. Today, we are talking about measles, also known as ham. Despite being preventable, it remains a leading cause of death among young children globally. We will uncover why this virus is so dangerous, how to spot the early signs, and the life-saving steps to protect your family. Measles is a highly serious viral infection caused by the rubeola virus. Before vaccines, it caused millions of deaths every year. It is so contagious that if one person has it, up to 90% of those close and not immune will also become infected. The virus lives in the mucus of an infected person and spreads through the air by respiratory droplets when they cough or sneeze. You can get infected by breathing these droplets or touching a contaminated surface and then touching your eyes, nose, or mouth. There is an incubation period of 10 to 14 days where you feel perfectly fine. Then, it typically progresses in stages. The first stage resembles a severe flu, high fever, persistent cough, runny nose, and red, watery eyes. 2 to 3 days later, Koplik spots appear, tiny white spots with bluish-white centers inside the mouth on the inner lining of the cheek. The characteristic rash starts on the face and behind the ears, then spreads down the neck to the trunk, arms, and legs. As the rash spreads, the fever often spikes significantly, sometimes reaching over 104 degrees Fahrenheit. Measles weakens the immune system. Severe complications include pneumonia, the most common cause of death from measles in children. In rare cases, the brain can become inflamed. A condition called encephalitis, which can lead to permanent brain damage or seizures. A physician can diagnose it based on history and the rash. However, blood tests, or PCR swabs, are needed to be 100% certain. There is no specific antiviral treatment. Antibiotics won't work unless a secondary bacterial infection develops. Supportive care is key. Vitamin A is critical. The WHO recommends 2 doses for all children diagnosed with measles to reduce the risk of death. The only effective way to stop measles is through vaccination. The MMR vaccine is incredibly effective, providing 97% protection for life by vaccinating. You protect the community through herd immunity, shielding those who are too young or too sick to be vaccinated. Science has given us the tools to defeat it. If you suspect measles, keep the person isolated and contact a provider immediately. If you found this valuable, please like and share. Knowledge is our best defense. Thank you for watching, and stay healthy.